This is the Impulsive Thinker Podcast, a show for high-achieving ADHD entrepreneurs. Together, we will inform and educate you about how to improve your self-awareness while developing systems, routines, and habits for conquering the entrepreneurial world. Here is your host, Andre Brisson.
Today I have Dr. Gurdeep Parhar. He's the medical director at the Adult ADHD Center based out of Vancouver, British Columbia, Canada. And they've got multiple services across Canada and all the provinces and territories. We had Dr. Parhar on earlier about talking about the myths of medication. And I wanted to bring him back to discuss how to advocate for yourself to your quote unquote unskilled doctor. Dr. Parhar, thanks for joining us again.
Thank you for having me on, Andre.
I want you to give another little quick plug about your Adult ADHD Center, because like I said previously, the mission that you guys have, it's a service that's well needed and it's an affordable service. So what do you guys provide adults in Canada?
Sure. Andre, so we recognize that assessment services for adults with ADHD, which is does someone actually have ADHD? Do they meet the criteria for ADHD? Or do they have some other condition? Getting that type of assessment done was just beyond the reach of most people. $2,500 to $3,000 with a psychologist, and definitely my psychologist colleague is doing an absolutely great job. But sometimes that price point is out of reach for many people. So what our goal was that we wanted people to be able to have their ADHD, possible ADHD assessed, determine if they have it, and then we would provide recommendations for both medication and non-medication strategies for ADHD, so that they can just get on with their life and start living a more productive life in school and work and their home life.
Oh, excellent. And you guys been doing this for a few years now?
Yeah, I think we're on to our 7th year, so it's been a bit of a whirlwind, and we survived COVID, and like I said, very proud to be offer services in every province and every territory in Canada.
Okay, so what we're going to talk about now is it's not only in Canada, it's not a Canadian problem. I think this is a worldwide problem where there's a lot of unskilled practitioners out there about ADHD. And I'm not trying to be offensive using the term unskilled. We're just talking in the sense of unskilled in ADHD knowledge, especially adult ADHD knowledge. Is that fair enough stuff?
Yeah, Andre, and I think it might help your listeners to understand when you say sort of not knowledgeable or not super confident in ADHD, and not to sound defensive, but maybe we just need a bit of context on why that happens. You know, I went to medical school in North America and Canada, and throughout medical school, I had 30 minutes on ADHD, and that 30 minutes was on childhood ADHD. This concept
you're not exaggerating. You're not exaggerating.
Not at all. And so 30 minutes, and that 30 minutes was on kids with ADHD. The concept of adults with ADHD wasn't even mentioned. And I was further unlucky because the pediatrician that I was assigned to for the childhood ADHD didn't believe in medication. So I came out of medical school, and then residency was much the same, with almost no training on adult. Well, actually, I didn't even know adult ADHD existed, and childhood ADHD I didn't feel confident diagnosing or treating. So and so I'm 30 years in practice now, so you can imagine. I hope the education system's gotten better, but I'm going to suggest to you that there's a lot of practitioners out there, family physicians, nurse practitioners, others that are in the same sort of category as me, is that they just didn't get the training. So when you say unskilled, really what I think you're trying to say is that they just didn't have the training or the awareness that the public has now even. And so that means that now you have practitioners that your listeners are going to, that may not know of this condition called adults with ADHD because they weren't trained in it. And then the second layer of complexity is now you're asking them to prescribe medications which they've never prescribed before, right? With antidepressants, we can use antidepressants for 7 different conditions, right? And other medications as well. But you will never use a psychostimulant ADHD medication for anything other than ADHD. Right. So if somebody doesn't diagnose or treat ADHD in their practice as a practitioner, they'll have never prescribed it. Now you have your listener going, well, first I have ADHD, and they're struggling with making the diagnosis, and now you're going to be asking them to prescribe something that they've never had any experience prescribing. Right. So it's a bit of a perfect storm in terms of the challenges, which is why we do the work we're doing. Is so firstly we do the assessments, but our big mission over the last 7 years has been a lot of health professional education across the country. So we're regularly holding evening talks, webinars, in-person talks. I'm probably giving 4 to 5 educational sessions, sometimes a week, but certainly a month, to health professionals across the country. And we're hoping to build capacity so people are becoming more aware. And I have to admit, over the 7 years, it's gotten better. Even the people referred to our center are often already started on medicine, or their practitioner says, I think this person has it. Whereas 7 years ago, they wouldn't have even thought about ADHD. So it is getting better, but the steps it's a slow process.
Yeah, and I like the fact that we're qualifying what we meant by unskilled, and I think this is where some of the controversy, that's the term that you used when we were offline here, it gets controversial a little bit with the unskilled doctor. And like you were just explaining, is the patient's getting frustrated, the doctor's not prescribing medication, but the doctor at the same time is prescribing a medication they don't know, understand, they can't do it. On a conscious level, they can't prescribe something they don't quite understand the effects of. So them resisting that is also saying, "Hey, I'm not too sure," and that can become a two-way struggle.
Yeah, absolutely. Yeah, that's exactly what I'm saying. And so it's frustrating for the patient, because ultimately it's not about the doctor. It's about the patients and the patient's needs. So it's understandable that the patient's getting frustrated, because they then are thinking, well, what do I do? I'm supposed to be going to my medical professional. And if they're not able to help me, what am I left with? What are my options?
Mm-hmm. Right? So we got to turn it into a collaboration of some sort with the doctor and the patients. And in my experience, I've always found, I think with most people's experience, I've changed my mentality about dealing with my general practitioner. It is now a collaboration, but for the longest time, it was always one way, doctor to me.
Right.
Is that a fair assessment?
I agree. And I think society, thankfully, has moved past that. There were times when, we were a couple of steps above God, or one step barely below God. Right. And I think rightfully, the health, I think this health literacy has improved through excellent programs like yours, where people are now being armed with information and knowledge. And so now they're going in and saying, doc, I think you missed something, or what do you think about this? I love it. And what scares me, Andre, more than anything, is somebody who doesn't ask questions or doesn't challenge me, right? Because then I'm wondering, did they really get it? Do they know what's going to happen with the medicine, or do they know what's going to happen with this condition? But when somebody comes in and they're got lots of prickly questions, then it reassures me they've done their homework, right? And the other thing around ADHD, which is, I think, challenging, is that, first of all, there are many people, not just physicians, but there's even lay public, even the public in general, that doesn't believe that it's a thing, right? There's people out there that still think it's bad parenting, too much screen time. It's just somebody being lazy and somebody not being motivated. So if you can imagine that physicians and health providers are just a subset of that same society. So if the general public thinks that, there are probably some physicians that think about that as well. And then there's other things, like with making the diagnosis of ADHD, one of the key criteria is that the condition has to have started before the age of 12. So it's easier when a 7-year-old is going to the doctor, or 9-year-old, because they're still under 12. Now, if somebody's 25 or 30 or 45 and they're going in, the doctor, in order to make the diagnosis, is going to be asking about what you were like in elementary school. So I don't know about you, Andre, but many of us don't remember much from elementary school. So if you don't have those childhood memories, or you don't have the report cards, or your parents aren't there to provide what we call collateral information, then the doctor is even further sort of impeded in going forward and making a diagnosis, right?
Yeah, and the one thing that's still around is you're successful and you did well in school, therefore you don't have ADHD.
Absolutely.
I'm still hearing that. Actually, my GP still says that to this day. He says, I don't believe you have it because you're successful and you're not having problems, but I respect the psychiatrist who gave you the diagnosis. So it's kind of a weird, conflicting little statement, but at the end, we are where we are, but it came with challenges and struggles. So how can we improve a collaboration with our GP regarding our ADHD, and if we want to pursue medication or changing medications?
Yeah, it's a great question. And I like the term you used, collaboration, because I think, and it's not just your health provider, it's also your accountant or your mechanic or your cook. Anytime the customer, the consumer, the client goes in demanding something, I think the professional's back gets pushed up against the wall, right? It becomes, well, I'm the expert, so, you can't come in and start demanding things. Having said that, it's your health and you should be advocating for yourself. So there has to be that sort of respectful balance of collaboration and power sharing, if that's what you want to call it. And so the first thing, I guess, even before we get to the treatment, is the diagnosis valid? And so you may think you have ADHD, and just be careful. There's so many online little, surveys you can fill out, and at the end of it, it spits out whether you have ADHD or not. Be very careful with those, because those aren't valid. They're okay to raise the suspicion that maybe you should go get checked, but that doesn't conclusively make a diagnosis. So be a little bit careful about using one of those online little bubble things. Now you can use it, you can fill that out and maybe print out the results and take it to your doctor and say, I filled this out and it looks like I scored kind of high. Do you think I might have it? But don't fool yourself into thinking that confirms the diagnosis. It can definitely raise your awareness and your doctor's awareness. So one tool that many physicians use for screening, it's called ASRS, and afterwards Andre can leave a link for it to you for it. But it's ASRS, and it stands for ADHD Self-Report Scale. It's a very simple sort of one table thing, and basically, a patient would fill that out and answer the questions. It doesn't diagnose ADHD, but it raises suspicion on whether you have it or not. So it's not totally accurate, but it may. So that might be something you take into your doctor. Say, listen, doc, I was thinking I had it, but I wasn't sure, so I filled out this form, and I have a lot of these symptoms. What do you think? Right? Rather than going in and saying, I'm not able to focus in school, or I'm not doing well at work, and I think I have ADHD. That probably doesn't give enough detail. So something like the ASRS may provide that. Mm-hmm. If you go in without that, the doctor should probably hand you the ASRS or some other set of questions, or even start asking questions themselves verbally, and that may help them, may help gather the information that they need.
You said something in there, and I don't think the listeners picked up on, but you said to bring that assessment in, and then what do you think, doctor? Mm-hmm. So it's not just you going and saying, I have it, give it to me. It's like, what do you have? What do you think? And it becomes a conversation, which is part of the collaboration. It's a two-way conversation. That's what with my GP, it's now a conversation, and that's why it's a collaboration, because I come up with something, he has an opinion, we have a conversation about that. So if you ask the doctor what their opinions are, now we're engaging in a conversation, and it's not confrontational on our part. And I know in the professional engineering world, if you tell an engineer this is how it is, you have no opinion, well, their ego really jumps in, and then they'll resist at all costs. And I'm not too sure if that's a similarity in the medical field, a professional ego, let's say.
I think it's with any professional. And when I say professional, when somebody goes to school and they have a body of knowledge or a skill set that they've trained for, it's natural to think that you are an expert in that area. I don't outguess my mechanic. When I say I'm hearing this sound in the car, and the mechanic says it's this thing, it's a carburetor, I wouldn't know where the carburetor was in the car, right? Mm-hmm. So there is a certain trust in there. But if I was to go in and say, what, I think this is the carburetor, he probably, if not outside, is inside laughing at me, because he knows I don't know what I'm talking about. So I think it's any field. It's not specific to physicians. I think in any field where you feel challenged by your client, there is that sort of hesitancy around that. So and I can tell you my own story is that even though I've been running this ADHD center, I still have some family practice patients in my practice, and they're people I've known for 30 years. And even a few weeks ago, I had this young woman come in and say, Dr. Parr, I think I might have ADHD. It was just never anything that came up in our previous visits. We were always, treating her physical issues and other things. And I said, so tell me about it. And she said, well, this and this and this. And I said, I didn't know that you were struggling in these different ways. So, even myself, who's supposed to be the focused on ADHD in our center, I've had a patient in my practice for 30 years. We never ended up talking about it because she didn't struggle. And now I'm learning about it. So I think it is that. It's a discussion about this is the way I've been. And, I may look like I'm confident and successful on the outside, but it takes a lot of effort to do what I'm doing. And I'm really struggling.
And I think that statement you just said there, it may look like I'm doing well, but internally I'm not. I bet you I'm going to give all the listeners a half a second to say, yep, that's me. So I'm glad that you've brought that out, that, it's an internal challenge. It's not a very external one.
Yeah. I want to go back, Andre, to one thing that you said that's, I think, really important. And you said your doctor still doesn't think you have it because you're such a smart guy and you're so successful. And that happens a lot, right? Mm-hmm. So if somebody comes in at a young age or even in high school, the physician says, you can't have ADHD, you're on the honor roll. right? Or you've done well in school. No, this is for people who are like failing in school, or somebody who's, a lawyer, accountant, mechanic, whatever, entrepreneur, whatever field they've gone into. And somebody from the outside says, well, no, there's no way you have any challenges, much less ADHD. Look how successful you are. It reminds me of the story of this accountant who came in, and she's very, very successful. I think she had 40 accountants in her accounting firm, and had a fairly significant ADHD. And I said, how I'm amazed that you've done so well, that you've been so successful. And she looked at me and she said, I wish you hadn't said that. I said, what? And she goes, I'm not here because I want to become more successful. She said, what people don't realize is how much effort I have to put into to maintain this level of success. She said, when I get home at the end of the day, there's nothing left in the tank. So I'm not here because I want to be more productive or make more money or get more clients or make my firm bigger. She's like, I'm putting in so much effort to maintain what I'm doing right now that I'm burning out and it's not sustainable. So when a doctor or psychologist or somebody or friends or family say, you can't have ADHD because you've done well in school or you're a successful person, what they don't know is the effort it takes. I had a discussion with a psychiatrist friend of mine, and he said, people who have ADHD and are not on medication, they're putting in 4 times the effort as everyone else to get the same task done because they have to strain to stay focused and attentive. On medication, they're still putting in twice the effort. So even with medication, that doesn't level the playing field. It brings it closer, but it doesn't level it. Right.
And that's why I said it's when we have to focus, that burns a lot of mental energy. And that's a lot of stuff I'm working with my ADHD transformation journey, is to get that reserve, have more energy in the tank to get home. And I'm glad you brought that up.
Yeah. But back to talking to the doctor about it, if you get brushed off based on you're too successful or you haven't struggled in school, make sure you share with them how hard it's been, how much time and effort or extra anxiety or your perfectionist traits that helped you succeed. Right.
I think that's a great point. Share the difficulties you have, not just make the statement. And the thing is, I wasn't upset with my doctor. He still says it from some time to time that he can't believe it, but I give him the benefit of the doubt because he's still thinking about it. He's still thinking about it, and he's not thinking about it to disprove it. I think he's starting to learn something new. And I think as a collaboration, you can't be 100% on the same page.
Right. And I think in one way, Andre, you should also see it as a bit of a compliment, right? Like he's sort of saying, yes, I've been told you have ADHD, but you've done okay, right? Like you are, and you put some systems in place, some coping mechanisms, and you've done, okay, or better than okay. And that's why I'm still wondering about this, is because you're a highly functioning person with ADHD. Yeah.
Now, the one last point I just want to make about this professional ego, based on your conversation and what I'm understanding, is sometimes it can be an intentional professional ego resistance, or it could also be a subconscious resistance, like you were kind of explaining a lot. And I see that with lawyers and a lot of other professions. It's just we have a lot of knowledge, and subconsciously we'll just resist because we were challenged. So I think it could be either or. It could be a subconscious or an intentional resistance. But I think as the patient, we just got to get over that and just keep trying and advocating for yourself. And that's a very important thing to do.
Yeah, and that's an important point. At the end of the day, it's really not about the doctor or the healthcare practitioner or your mental health worker. It's really about you. And so the easiest thing to do is go to the person that you have had a long-term relationship with and get them on board. Now, if you really hit a hard brick wall and you're not getting through, then you have to make a decision. Do you stay with them for this part of your health, or do you look for some help elsewhere? Because you don't want to go through more years of not having your ADHD assessed and treated.
And with that point, if you're going to change a practitioner or go get help somewhere else, there's nothing wrong with that. It should not be a personal attack to the practitioner. It's just, you got to take care of yourself. If you're not getting that level of service, it's like, if you keep going back to the same car mechanic and you're having the same problems, they keep fixing everything but the carburetor, you're going to go to another car mechanic to get a second opinion and to get the carburetor fixed. And there's nothing wrong with that, right? Because in the end, you need your car fixed.
Yep. And absolutely. And there might be a bit of a middle ground, Andre, kind of like what you're implying when you said you saw the psychiatrist, is maybe ask your family doctor to refer you to someone else if they are hesitant or aren't sure if you have it. Because that way, your practitioner, your primary care practitioner is still on the team, right?
Yeah. And that's the other thing too, with a common colleague of ours, Christina Crow. she's really working hard as a psychotherapist to make sure everyone on the medical team communicate to each other, the psychiatrists, the general practitioners, psychologists, psychotherapists, and all that, and get that medical team around you and talk to each other. I think is also key because everyone understands what's going on around you. How can we present our concerns and our opinions effectively to the doctor who's not well versed? Maybe that's a better word than unskilled, is to say not well versed in ADHD.
Yeah, another good question. So I think I would take the tools in the ASRS. You may want to invite them to explore the resources. CADRA is probably the safest one, and I think everyone may know about that. But the CADRA resources for health professionals are excellent. It's the one that we rely on. So it has on there how to make a diagnosis, has on their medication charts. So you may want to, and it's not biased in any way or commercial. So I think that might be some safe places for that you can take them to help make them more aware. But at the end of the day, it's probably not your job. You're trying to manage your ADHD. It's not your job to educate a physician. I think you can only go so far. And if there's still some resistance, ask for a referral to someone else. Or unfortunately, you may have to find someone else on your own. And that may be the way to go. But I think the best thing is to take in some reliable resources. So the ASRS would be a good place to start, the CADRA practice guidelines, and hopefully they'll attend an education session somewhere and learn more about it. And like I said, generally across the country, the situation is improving. It's just those steps. The other thing that I think you said in an earlier program, Andre, was around the medication and them being sort of controlled substances. Unfortunately, the medications aren't as abused or misused or diverted as people think they are. But unfortunately, practitioners start treating them as same as an opiate or benzodiazepine or other really addictive or harmful medications. And so there is that extra caution around treating people with these medications. But what I always say to healthcare providers is, yes, there's a risk, but what's the risk of not treating someone's ADHD, right? And that's really what we need to get them to, is that their lives are at risk in various settings, their work, their home life, their addictive behaviors, all that type of stuff. So.
Okay, so you mentioned the CADRA website, which is the Canadian Alliance of ADHD. I forget exactly how that acronym works. CADRA stands for?
Canadian Alliance for ADHD, Resource Alliance.
Resource Alliance. So basically, it's the Medical Practitioners Alliance sharing medical information. Well, we also have CADAC, the Center of ADHD Awareness Canada. That's more helping the people with ADHD, which is similar to CHAD in the States and ADDA in the States. You said to use reliable information from CADRA. CADAC's another good reference. But so what did you mean by that, to get reliable information?
Yeah, good question. And I just looked up the acronym, so I was going to quote it properly. So CADRA stands for the Canadian ADHD Resource Alliance, so CADDRA. And what we're saying is that there's a lot of misinformation on there. When you go to Uncle Joe's ADHD page, there's all sorts of both diagnosis information but more worrying for me is treatment information that it hasn't been sort of research approved or Health Canada approved. And so we have to be really careful with that. And that's why I say, when I say reliable, the practice guidelines and the diagnoses are all research backed. And so if somebody says to me, how did you make the diagnosis of ADHD with Andre? I can say, this is exactly how I did it.
Right.
And so you need to be able to sort of defend all that. And same thing with the medication choices, because the medications we recommend are in the clinical practice guidelines for ADHD, is that we can say, yes, the guidelines for treating ADHD in Canada are to use these medications. And that's what I meant. So the cadra.ca website, so it's caddra.ca website is a great resource. And there's sections on there for health professionals, family members, patients themselves. But there's a health professional section. If there's no password restriction there, you can access it. And if you're really motivated, you could even find a couple of the resources there and print them out and take them to your doctor as well.
Right. Because it's got a big explosion, especially over COVID, on social media, TikTok, Facebook, about a lot of people talking about treatments, recommendations. And there's quite a few of them are not medical professionals. What I find, though, a lot of those are anecdotal. And is that the kind of stuff, is that applicable to be bringing to your professional, or what are your thoughts on that?
Yeah, so for those of us who are trying to raise the awareness of ADHD, we won't complain that there's more people talking about ADHD, whether it's on sitcoms or movies or social media and TikTok and so forth. The unfortunate thing is that it can cause a bit of a reaction or a pushback. And I was even speaking to someone yesterday who said, well, it seems like everyone has ADHD these days, right? And so once you get into that, you feel like there's a bit of cynicism or a bit of suspicion that the diagnosis is being made too easily, that everyone has it. It's become an excuse or a crutch for some people. And that's not fair. You wouldn't say that about depression. Just like depression, ADHD doesn't have a blood test or a brain scan that we can do. When I diagnose somebody with depression, it's a list of symptoms and their severity and how long they've gone on. And guess what? I treat their depression. So I don't think we should hold ADHD to a different expectation. But I think what's happened is that because people have sort of publicized it, there is a little bit of suspicion on those. And to answer your question, I don't think you should be taking those kind of resources to the physician, not because they're not good. In fact, I think they're excellent. I think a lot of the stuff on TikTok and Facebook and so forth are excellent resources, and they're doing a fantastic job of educating YouTube as well. It's just that the physician may not find that as reliable as something that's more of a document written by health professionals, and because it'll have footnotes as to the research that they're referencing, whereas the social media sites often don't reference all those sources. Yeah,
and that's a professional thing. No matter if it's a lawyer, accountant, engineering, or a doctor, we got to back up. So I'm speaking from a professional engineer. I have to back up my decisions on stuff that's reliable, so that if something does happen, I can explain and prove that I did something correct. So it's not that they're maybe resisting you. It's just we got some professional rules to follow at the same time, but we got to back it up and make sure it's the right thing for the patient as well. So now that's good. So what I want you to take away from today's conversation is go to your doctor with good and reliable research and information, and especially with your personal observations of yourself, to engage your doctor into a factual and rational collaboration about your ADHD. And I like the term collaboration. And just to summarize here, make your doctor-patient a collaboration, not a one-way conversations. They are the experts in medication or in medicine, and you are the expert of yourself. So advocate for yourself. And it's a two-way conversation. A collaboration is a two-way conversation. And I like what Dr. Pahar said. When you want to talk to your doctor, share the difficulties you're having that are behind the scenes that can't be seen. And I never thought of it that way. And I think that's a great piece of advice. And for you, the listener, ensure you have proper research and observations that are valid for your professional to help you make an ADHD diagnosis valid, and that they're presented in an effective manner so your doctor can help you. Any last thoughts, Dr. Pahar?
Yeah, I think you said it brilliantly. The doctor, the health professional, the psychologist, they're experts on the disease. They're an expert on the medical condition, but you're an expert on your life experience and what you're struggling with. And so you both won't succeed in that relationship, them as being your healthcare provider, you as being their client or patient, unless you both share information. They need to share information about the condition that they've studied and should understand, and you need to share your information about your life experience. And that's the way it's going to succeed.
And I can't top that finish. So thank you, listener, for listening. And we'll talk to you and listen to you again. Thanks again, Dr. Pahar.
You're welcome. Thanks for having me on.
Thanks for listening to this episode of the Impulsive Thinker podcast. If you enjoyed it, subscribe, rate, and review the show. It helps us get discovered by listeners like you. If you can share it with at least 2 other people, that would be greatly appreciated. I want to gift you the Shit List. It's a weekly planning tool that I developed to plan my week and focus my time. You can find it at our website at tacticalbts.com. That is tacticalbts.com. Talk to you soon.
Thank you for listening to the Impulsive Thinker podcast. If you have a question, comment, or suggestion for the show, please visit theimpulsivethinker.com. The Impulsive Thinker podcast is produced by Tactical Breakthroughs and hosted by Andre Brisson. Remember, ADHD is only a part of you, not all of you.